Building a world-class department is a journey. It's a journey in research, it's a journey in education, it's a journey in faculty development, it's a journey in philanthropy. Relatively to other urology departments, we're a young program. We started this program really in the early 2000s. And it's incredible to see how the program has progressed over the last 2 decades. And we're at a point now that we are really recognized both nationally and internationally. And that's really exciting to be part of that, to help grow that, and see all the folks around me be successful. The way we here at Hackensack have organized our department and our journey is to really focus on 4 pillars of excellence. 1, clinical outcomes. 2, research. 3, education. And 4, philanthropy. When I think about clinical excellence, it's a combination of things. Number 1, are we innovating? Number 2, how are our clinical outcomes? We are focused on patient outcomes. And because of that, we measure them every single day. And we compare them every single day, not just to ourselves, but to the rest of the academic programs. And because of that, because we know our data and we compare our data, we know that our outcomes are a cut above the rest.
You know, in robotic surgery, the SP single port robot is the thing, is the latest. As a center, Hackensack, we celebrated our 1,000 cases, which is the first hospital to reach that goal. We have moved into a brand new state-of-the-art hospital. I never seen something like that in my life, and I don't think any other place in the country that has something similar to us.
10 years ago, Hackensack Meridian Health realized they needed to reinvest in Hackensack University Medical Center, specifically their ORs, their ICUs, and their surgical care. By getting the input of physicians, nurses, OR staff, cleaning, environmental services, radiology, we were able to build a smart hospital.
We see a lot of women with recurrent UTI. We are working with our colleagues in microbiology at the Center for Discovery and Innovation at our medical school to identify the reservoir for recurrent UTIs in women. This research has never been done, and we hope to identify some reasons why some of these women develop recurrent UTI.
Whether it's prostate cancer, kidney cancer, or bladder cancer, there's a clinical trial here at HUMC that really provides the best and most effective and innovative treatment for patients in the safest and most effective way possible. You know, for example, when you talk about bladder cancer, you know, we have patients who come in that have had prior treatment somewhere else. Their disease is now resistant to the standard of care opportunities that are provided in the community, such as chemotherapy or intravesical therapy. And we can now give them a clinical trial for a new therapy that can really help fight that cancer, whereas otherwise they would have had no other options in the community.
Our institution has the largest volume of single-port robotic surgery in the United States. And this data, this large volume of data, has been put out there and published in the literature, presented in many conferences. We've been a leader, the forefront of this research.
Teaching is an important part in our department because we're at the forefront of training the next generation of urologists. Among the really talented medical students out there, every year we think we're really able to attract some of the best here, and in a way, being sort of the new kids on the academic block, we're really even more excited about embracing innovation and new technologies. So part of the enthusiasm is that we're really trying out new ideas and anything that's going to advance our field in terms of patient care and education.
The impact of philanthropy on the Department of Urology has really led to a number of different things. For example, are pioneering research in the areas of urologic oncology, minimally invasive urology, men's health, female urology, and even pediatric urology. We created a Center for Pediatric Urology. We produced a Men's Health Day this year focusing on prostate cancer. We also have visiting professor programs where we learn from our peers about the latest advances in the field. And finally, we have educational programs for our residents and fellows where we shape the future leaders for tomorrow. I can sum it up with one of my favorite sayings. We make a living by what we get, but we make a life by what we give.
What's really exciting to work here in the Department of Urology can really be summed up in 2 words: cutting edge and collaborative.
The future of urology and future of medicine is just so exciting.
We are passionate about what we do, and that passion is infectious amongst all of our team members.
This great journey is just the beginning. More and more is to come.
Come find out where the journey will take you.